Morning, my name is Elijah Tudiagmanawe, and I do welcome you to this segment of Morning Breeze. It is the breakfast meeting. In this particular segment, we discuss matters business and socio-economic matters that do impact your life on a daily basis. Well, over the weekend, I had the opportunity to move around the country and I've noticed quite a number of changes, and I'm still amused by how intact and natural Uganda still looks. That's a plus for us. Well, today in studio, I'm hosting two ladies, and we're going to be discussing matters of stigma and discrimination among women, but particularly we're going to be looking at HIV and issues with stigma and how it has affected our social lives. In studio today, I have the two ladies. I'll start with the introductions. The head of advocacy and strategic litigation, that's Immaculate Owomujisha from Uganet. You're welcome to the studios.
Thank you, Elijah.
It's a pleasure to have you. And at the extreme end is Flavia Zalwango, the program's director at Human Rights Awareness and Promotion Forum.
Yes.
You're welcome to the NBS studios.
Thank you, Elijah.
Now, to start with, I'll start with you, Miss Immaculate Owomujisha.
Yes, please.
Let's start by defining stigma. What is stigma?
Okay, so stigma broadly, maybe if we go with how the laws and laws at both at international level, but also how it has been domesticated here in Uganda, we are talking to the issue of being in that position where you're not able to speak for yourself, in the position where you're not in position to defend yourself, in position where you feel like you've been excluded from what society perceived to be the right issue. Here we are looking at stigma happening in different ways. It happens both at family level, community level, and at institutional level. And this stigma can also at times be a personal feeling, but this personal feeling is attributed by what surrounds them. And what surrounds them is the community, the family, and the people around you. What do they put you in the position where you feel I'm in a position to speak, and I'm in a position to defend my rights. I'm in a position to be a true me as a person, regardless of my gender, of my sex, my HIV status, name it. So that's where we come in.
Can you draw a line between stigma and discrimination? Okay. Or they go handy?
They go hand in hand. Where you find, in most cases where there is stigma, you'll find there is discrimination, because both of them are attributed by the attitudinal norms of people in society and people around us.
As you can probably, I'll take you back a little bit to your introductory statement. What are your roles in the fight against stigma and discrimination as Uganet?
So for us as Uganet, what we basically focus on is to make sure that the environment is enabling. And how do we want the environment to be enabling? We want people right from the grassroots level, which is the community people, are put at the same level, same footing, in terms of accessing resources, but also in terms of being respected and loved by community members. And then when we come to the institutional level, we also focus on what policies, what measures at different institutions that make people comfortable to be in that place. And then at policy level is where we focus on issues of enabling laws. Are our laws very clear to support people, that to make sure that women, for example, if we go back to what the agenda of this Zero Discrimination Day, that women can be in a certain position without compete with the main gender without fear or favor. If there are people living with HIV and I am looking for work, will my status be looked at as an impediment to access work? So we do our work right from the community, sensitizing communities, then we influence policies, and then work with institutions to change some of the culture that happen at different institution level.
Thank you, Immaculate, for that submission. I'll be going to Ms. Flavia Zalwango from the Human Rights Awareness and Promotion Forum.
Yes.
Maybe to start with, you'll give us a brief background of what your roles are, what are your objectives as an institution? What roles do you play in ensuring that you advocate for equality. Zero discrimination days observed each year on 1st March, which was yesterday. What are some of the activities that you undertook as an institution that is covering this docket? But perhaps you can also take us through what is Uganda's position as of now in the fight against discrimination against women and girls?
Okay, so to start with, I'll start with what we do and what is our role. So Human Rights Science and Promotion Forum, HURAF, is human rights organization, and we focus on access to justice mainly for vulnerable groups. So what we do, what do we do in terms of ensuring that actually we fight against stigma and discrimination? We sensitize communities. Like we're going to also start from the communities to talk about these issues. We talk with the communities, we talk with the duty bearers, we talk with people who are responsible to ensure that people are not stigmatized, but also create awareness on the issues that are surrounding the community and what they go through, and why we think that stigma should be fought. Because in terms of HIV, if we do not fight stigma...
What are the dimensions of stigma? Because if you look at stigma, one would interpret it as something that is outdated or an old school thing, that today's society, considering the various advancements that we've taken, it doesn't affect us no more.
Of course, we have a stigma index that was done. Now, the last years of 2019 was the second stigma index that was done. And the stigma index showed that actually we still have stigma. But, and it showed that external stigma actually reduced, but we still have a lot of internal stigma. What is external stigma? External stigma are the factors surrounding you that actually causing you to be stigmatized. Things like exclusion, things like gossiping around, things like, for example, if someone is HIV and they walked in a place and everyone is looking at them and they're saying small things around, that will make them feel bad, and that may actually bar them from going back to that place. I'll give an example of key populations, or we have women living with disabilities. People have been stigmatized in health centers where they go and ask them, you're a sex worker, I thought you're looking for HIV. How did you get pregnant when you're like this, when you're physically disabled? How did you get pregnant? So such things actually cause them not to draw back and say, I'll not go back to the health center, I'll not seek treatment. Internal stigma is what you're feeling inside you. You feel depression, you feel disowned, you don't feel like you need to engage with people, you don't want to go in social gatherings, you keep to yourself because you think you're not wanted. Other people make you feel like you're less of a person. So that, in most cases, draws people back and they won't engage. So stigma actually is real. Give an example of stigma at workplace. I've also talked about stigma in health service, in health system. Stigma at workplace. There are some people who can't employ people living with HIV. And if you start with even petty jobs, the stigma index showed that a lot of stigma was in terms of accessing jobs out of the country. Some people weren't allowed to go and work abroad because of their HIV status. And also stigma in families. Many families, as we think that HIV stigma shouldn't be there, and all of us are aware that HIV is transmitted through known means, but people still think that when you associate with an HIV positive person, they can infect you. Give an example of domestic workers, our maids we have at home. We've had so many scenarios where actually families have taken them for testing, and when they find them positive, they actually chased out of their homes. So stigma actually is real. It's not an illusion. It still happens, and it only, a person living with HIV can only understand what they are going through, because some things look so small if For example, even disclosing, it's not an easy thing. It is still hard for people to disclose because of what comes to you after disclosing. You imagine if I'm at a workplace and I tell them I'm HIV positive, will they even give me equal treatment like any other person? The fears that people have to disclose, the fears.
Given the social background that you've given us, I'll allow you to take us through the figures. You mentioned the index, the stigma index. Take us through the figures so we can ascertain the impact on society today.
So, in terms of people who still feel guilty for being HIV positive, the index showed that in the last index, the previous index, it was at 50%. And today it has reduced to 24%. That still has an impact actually on people. But also in terms of people who don't want to go to social gathering, it was 7.9. Those who felt like they shouldn't go to social gatherings. Those who felt like they shouldn't apply for jobs, 6%. And in terms of people who felt like they shouldn't actually have sexual partners, 20%. Those who chose to say, I am not going to engage with anyone, 20%. And people who have isolated themselves, people who have said, I'll keep to myself, I'll be home, I'll not move around, 14%. So if in terms of relation to the number of people we have living with HIV, that is actually too much of the percentages that was sampled out. Of course, that is in terms of the sample space and sample size that was used, but also we use that one to infer to the entire population.
Absolutely. So
that is still happening, and sometimes people, I've heard people joking about HIV, by the way, and saying, HIV is like malaria, and until you get to that corner.
So do you actually think the stigma actually affects their health more than the real disease?
Yes.
Itself.
Stigma actually kills than HIV itself, because if you cannot go to seek services, that will kill you. But depression, stress kills than the virus. Before you get some, actually within even when you're not HIV positive, depression can kill you. Stress can kill you. So it kills. Stigma is more dangerous sometimes than even the virus itself.
Okay, that's right there. Immaculate, okay, you can weigh in, but I would want you to go in the direction of what are some of the steps that we can take as society to change the mindset against HIV and stigma without necessarily raising the dust and causing this whole commotion and actually making the situation even worse.
Yeah, but allow me to first quickly weigh in that even when we're coming in, there was this documentary that was being run by, and we see the founder of TASO giving the history of where they came from when they were starting TASO, and the whole idea behind TASO was because of the stigma that was happening those days. That is in late 90s. And she ably said that actually it is a point where she feels frustrated that we are not going forward. We are actually going backward. And why are we going backward? Because we still see that things that pushed them those days of starting TASO, which was to have a stigma-free society, and the TASO was formed at the point of having patients feel loved. We still see the same happening today, where people living with HIV are not loved. I will give an example of some of the cases we've worked on, where it is a clear example of stigma and discrimination. One of the cases was a case in Gulu, in Kitugumu, where the lady just touched a baby, and the moment they found that she was HIV positive, she was sentenced to 2 years.
For touching
the baby without any transmission of HIV to the baby. We had another case recently in Nabuero. Then she was playing with a baby in her house, and when the mother of the baby came in, the mother said, "Oh, you're breastfeeding my baby." And according to her, she says, "No, I did not breastfeed the baby, but the fact that the first step that is taken in criminal justice is to test for HIV positive. When they tested her and she was HIV positive, she was immediately remanded to prison. And there is no HIV transmission at that point. So you can see how stigma is still with us. Absolutely. And it is actually embedding so much into the community. And then those who should actually not be promoting it are out there. So the moment they hear a case, before anything happens, there is a big outcry that a person living with HIV, and that's how it is usually reported, it is a murderer, you're a killer, you're a monster, you see. And what is that embedding in the society? Hatred. And that hatred is growing every day. We see it growing.
Being the head of advocacy and strategic litigation at Uganet, Immaculate, I would want you to highlight some of the areas legally. What are the policies that regulate issues to do with stigma? What do they stipulate? Okay,
currently, right now as a country, we start with our constitution. Our constitution is very clear that all people should be treated equally. And that is the mother law of the nation. So regardless of your HIV status, if the law is saying that let all of us we are all equal, then there shouldn't be any other impediment to that. Then we come to the specific laws that also focus on people living with HIV. We have the HIV Prevention and Control Act. 99% of the law is good. It's good in terms of protecting the rights of people living with HIV, though it still has some bit of challenges when it comes to disclosure, another person disclosing your HIV status. And then we have also now the policies. There are different policies at Ministry of Health. Ministry of Health, Uganda AIDS Commission, that have been put in place to ensure that people living with HIV access eco services. The Patient's Charter. The Patient's Charter clearly illustrates the rights and obligations of a patient. And these are all with us. But the challenge that we still have, even those who are supposed to be implementers do not know about these laws. When it comes to implementation, that's where we see the biggest gap.
One would ask, why is HIV and TB still a big deal in society? Why are we still discussing it? Yet most people, they'll tell you, if you go back to scientists and doctors, they'll tell you today HIV is not a big problem than it used to be back then, but we have more cases of people dying of cancer.
I think for HIV specifically, it has always been looked at as an moral issue. That when you're found to be living with HIV, they think either you did not do what is right, what morally, what society perceives to be a right thing. And that has kept with us. It has kept with society that people living with HIV go looking for it. They forget that we have now young people who have been born with HIV, have grown. They did not call for it. And there are different ways people acquire HIV, not necessarily through sex. So for HIV, that's where the major problem is. For TB, it is an issue, it is an epidemic. It is the way it is transmitted, because even as we speak, Elijah, that if I have TB, you can equally get it. Because it's an airborne thing. So, being that easily transmittable puts people in place of fear. And being in place of fear makes people isolate those who are living with TB. And that becomes a challenge, that you're stepping on someone's right just because of the disease.
I get it. Now, Flavia, what are some of the major areas where women and girls are discriminated and facing stigma today? If you'd highlight and give us some cases or scenarios where it has been witnessed.
One of the areas is, I think, gender discrimination, but also that goes to women, because in most cases, they actually get to know of their HIV first before men get to know. So that leads into gender-based violence or domestic violence sometimes, because when a woman goes to give birth, they have to be tested. It's mandatory. So when they get their HIV status, they get to know, they go back and tell their husbands, and then they'll be accused of bringing the virus. But also because of, I think naturally women, not thinking, but it's proven that women's health-seeking behaviors are better than men's health-seeking behaviors. So women would want to go to hospital even when they have a headache, even when they have a stomach pain, they would want to go to the hospital. So even when it's not about giving birth, they usually get to know about their results before men get to know. So they are usually victimized as the people who have actually transmitted the HIV. If you talk about sex workers are always victimized for looking for HIV and spreading it. But one cannot be a sex worker without a partner, so they usually go with men, and men are not talked about in this issue. So the issue of gender inequalities and discriminations are one of the things that actually bring about discrimination within the HIV environment. But also, who takes care of sick people at home? You find that even when it comes to people who are affected by HIV, it is mostly women. We take care of the sick people at home. We are the one nursing the children that we get, and they're infected with HIV. Sometimes marriages break because the woman has given birth to a HIV positive child, and who do they leave the responsibility with? It is the women. So a lot of discrimination within that is connected to HIV hits back at women. And for me, my issue is that even when we don't have proof, actually, we don't have, I think, the science yet to identify who caused the virus. But usually, you've always also had the cases she referred to. Those who are women, we nurse children, we do domestic work. You find that all the time it is women, women.
Are there areas you think should be improved on a personal level? Because, like, when a person is sick, the person that is treating them, it's usually on a personal level, either at home or in society, at school. Are there areas you think that specifically needs to be paid attention to?
I think one of the areas is, I'll start with the area of the person living with HIV. I have talked about self-stigma. It's still high, but for me, my advice would be that as a person living with HIV, there's need, which is not very easy, but to try and overcome self-stigma, because it is a serious problem. Once you overcome self-stigma, once you disclose your status, there's a relief that people get from disclosing their stigma. So on a personal level, that is where we begin from. Okay. And I think in terms of also personal level to people who are living with HIV, we need to stop discriminating people. We know how HIV is transmitted. It is through blood contact and food contact. So drinking on the same cup, playing around with someone who has HIV, your children mingling with someone living with HIV, doesn't spread HIV. So I think we need that self-awareness to understand.
Absolutely. Immaculate.
Can I just chip in there?
Yes, but before, okay, of course, our time is first spent. Okay. I would want you to weigh in on, there's been quite a number of avenues that have been put in place, like girls' education, affirmative action. Haven't all of these registered results, or what more do we need to do?
Of course, we have to applaud the government that they've given the girl child all this space. The affirmative action, or we see we have now women in leadership at different levels of leadership. That we really clap for the government for giving us space. But there's still more to be done. And for where we come from in the issue of HIV-related environment, it's where we come up and say that, okay, we are seeing, for example, at home, it is very difficult for people nowadays to employ a caretaker in a home once they get to know that this girl is living with HIV. And we know that most of the caretakers in our homes are young girls, and these young girls, most of them, they could be having virus. Even at employment, we've seen all these employment agencies. Once you have HIV, once you're living with HIV, they can't take you on.
You did mention government and applauded them. What is their role in the fight against stigma?
The role of government is to make sure that we have clear policies and the policies are well disseminated. Most of these policies are done and they are kept in their shelves. So let the policies reach the policy users, and then the policy users make sure that they make sure the community members get to know about them. Once we have good documents, and Uganda is known for that, we have good documents, but the documents are not well utilized by those who are supposed to use it. So how I pray that there is always resources that once we have a good law or a good policy, it is well disseminated and disseminated widely and in the languages that people understand.
How can civil society organizations help to fight against stigma and discrimination?
Our role is very clear. We mobilize communities, we sensitize communities, but we do that when we also know we have a clear backup, and the backup is the law and the policies. So civil society, my prayer is let us not get tired. Let's continue speaking. Speak at every level we are at, whether at grassroots, whether at policy level, whether at institutional level. Let's continue to engage. The more we engage, we are dealing with issues of attitude. The more we engage, the more people keep to change, because changing attitude is not something that happens in a night. It takes time.
Absolutely. You can only keep the engagement if you're registering results.
Yes.
Because you've been around for quite a while.
True.
Are there positive results?
Yes, there are positive results, and I think that's where we are seeing some of the laws that are coming up. We now have an anti-stigma policy that is being drafted, though it is not yet finalized. But we see government has taken that leadership role in putting up an anti-stigma policy. How we pray that it is now, it gets certificate of financial implication and it is well disseminated to the people that need to know about it. Yeah, so we see that progress.
Thank you very much for speaking to us.
Yeah,
I don't know if you have any last remarks, so I'll give you that opportunity, but if you don't, we can as well close the show and call it a morning.
Yes, I just want to, on the issue of what has been done, I think a lot is being done, but also I talked about the stigma index. It's a very good document. We have the gender assessment report. It looks at all these issues of discrimination and stigma and issues of gender in relation to HIV. We have the human rights equity plan. And I think if all those documents are disseminated nationwide, will be covered. But I think also at grassroots level, we need to continue, like you said, but also promoting human rights within our communities and ensuring that actually people understand that everyone has a right to access services without discrimination. So we need to keep on singing the song of equal treatment and equal access to services for everyone.
Absolutely. Yes. Thank you, Immaculate. Flavia?
Yeah, Immaculate. For me, it is let's not take a back seat. Let's not get tired of talking. Let's continue talking. And we have to talk at all levels, right from the leadership of the president to the person at the grassroots. All of us have to continue speaking the message. We are seeing where people are taking a back seat, and recently the president said it, that we have actually, we fought HIV and now we have taken a back seat. We need to come back from that back seat and take the front seat and continue to fight against the epidemic and all these kind of forms of discrimination that happen in different ways at different levels.
I do applaud you ladies for the great work you're doing in society, and thank you for holding this discussion with us.
Thank you, Fan.
At the extreme end, that was Flavia Zalwangu, the Programs Director, Human Rights Awareness and Promotion Forum. And on my immediate left-hand side, that's Immaculate Owomjisha, the Head of Advocacy, Strategic Litigation from Uganet. Well, you allow me to close this particular discussion here, and you can continue with the conversation on all our social media platforms. Keep it NBS. Always. It's a good morning.